Good morning, everyone, and welcome to Perspective. It's a pleasure to be with you once more. It is Monday, June 21st, 2021. It is supposed to be the longest day of the year. Let's see. Sun is supposed to set real late later, but it's raining, so don't know if we see the sun today. But anywho, trust you're up and about wherever you are. Wherever you're joining us from this morning, we welcome you. First of all, welcome to those of you joining us on air on MTV, also on MTV's Facebook page. We thank you. Those of you on Mikey Live, a special good morning to those of you on Sister Isle who are joining us from Sister Isle Radio in Carriacou, and of course Partygrenada, TNR Communications, and our own Facebook Perspectives page. I am Brenda Baptiste. Good morning, everyone. And it's a pleasure to say good morning to Senator Christopher Allie and Mr. Byron Campbell. Good morning, gentlemen.
Good morning, Brenda.
How was Father's Day?
Well,
And that's for the crew, too. Everybody, Father's Day.
my Father's Day was quiet. I rested. I was pampered. I could eat something.
Ooh, nice.
Yes, very quiet.
Big up to the Deali household.
Not much. Good morning to all our viewers on Perspective. Again, we happen to be here and to discuss the issues. For me, Brenda, this is one of the issues this week. Our Prime Minister is going to be
Yes.
speech.
Yes, I looked at it. I looked at the stream on Saturday, and I thought he did a very good job. Yeah. We need to start talking, man. We need to just do it.
Yeah. And the last thing I want to talk about is vaccination again. You know, you cannot not talk about vaccination. And my issue with it this morning is that I noticed the government put on an incentive program where the veteran tickets for them to vaccination and you can get money up to $10,000 and so on.
Right, over the lottery.
Right, I have a difficulty with that in the sense that I know a lot of people, a lot of countries around the world have different incentive programs and that thing. But when you're doing that, I think we need to also incentivize in a different way that we have it vaccinated to come. I would also like to say that when we have effects in certain things, and we have promoters doing certain things, and we want to encourage promoters back on. Put that as a mandate as well. You can't mandate that you take it, but the mandate is that if you want to come to my effects, should have been vaccinated.
Well, only on Saturday I was driving, and Waggy T, he announced his all-inclusive for July 31st, and so only fully vaccinated patrons.
Is the way to go. Good morning. Yeah, is the way to go. Good morning.
But do you have concerns that you are seeing activities, social activities, where there's a mixing of the pool, or where there are people the threat of people who are not vaccinated?
We are told that there are effects going on in certain places. You're coming at 11, you stay for the entire, you don't go out, and you stay there until 5 in the morning.
You did it? You stay till sun up?
Yeah.
Ah.
And that's the next thing. I'm not quite sure.
Want to go to a fed so?
Let's go.
From 12 to 4, it's probably
12 to 5, or is it 4? 4.
5 or 4.
4. Okay.
12 to 4.
And probably you can expect, it just seems as though if we have these, what we want to say, inclusive, I can't say exclusive, inclusive fests, where you're moving at 11 and you're leaving at 5 when it clocks.
So wait, because what you're talking about here is a dynamic that is not an official thing, but you're saying that it has become a social norm,
Yes.
that people are going into feds at 11 o'clock
Yes.
and exiting at 5?
Yeah,
And who's
so,
controlling that?
I suppose the people who happen to fet. And
So then, okay, then I get,
in other places as well.
Yeah.
well, if that is the case, I get the curfew question, because if that going on, why we are curfew?
Well, that's the point.
Yeah.
And, so I think we need to be more consistent.
Yeah.
We have, I saw some, the usual boats, fets that we just have. And they're going on. I don't know if we need to say they must be vaccinated at these folks.
On the rum runner? Okay. But they're not doing the numbers pre-COVID.
I'm certain not.
Yeah, I think they're doing limited numbers.
Permission from the authorities.
Yeah. And they've been down for a while. It's good to see them back on, yeah.
I think you should just say only vaccinated people.
Yeah.
The vaccinated people right now are privileged, and we must exercise the privilege. Those who have taken, and I respect the right who don't want to take, that is their right, and I respect their opinion, but for now, those who are vaccinated are privileged, as far as I'm concerned. Right?
Listen, people see that as discrimination, Mr. Campbell. The fact that, let's talk about that. Let's talk about that, because we enter in a zone where it is going to be a case where vaccination and public health and the safety, and people are starting to say that they're feeling discriminated.
Look, morning all. Here's a scenario. There's a pandemic. There's a worldwide pandemic.
People didn't think so.
I learned that the deaths in Brazil has gone 500,000 people.
Yes.
500,000.
Yes.
So just in kids there, we have some spikes again. Look, there's a pandemic. There's a crisis. There's an emergency in the world. Grenada is not. We are not in some bubble isolated by ourselves. We are part of this network. Our borders are porous. It's open.
You sure we're not in a bubble on ourselves in a corner?
So we need
okay.
to. We need to
get confused sometimes.
We need to get real here about this. That first of all, we continue to have a relatively high hesitancy, one of the largest in the region in terms of persons reluctant to or not willing to take the vaccine. We have our borders are opening. We are beginning to congregate in a normal way or socialize in a normal way. I mean, if you pass through St. George's Friday evening or you around the island during the week, it's almost back to normalcy in many environments. So the virus is not going to say, okay, I'm not going to come to Grenada. It can happen as it's happening elsewhere. So we need to get real, and I hear the argument about, well, should vaccination be mandatory or otherwise? And the unions are making a big point about it, that's saying, well, it's a human rights issue? That's what they're saying. It is maybe, and to the point that, well, it's not a contractual arrangements that we have ongoing, but this is an emergency. And so part of the argument is that, well, the vaccine is not approved for normal use. It's approved for emergency because we have an emergency globally right now. So I just want to say that.
So what's normal use though? People seem to be mixing up experimental use vis-a-vis emergency use. Yeah. And our guest this morning, I guess, would help us with some of that. Because, we have too many scientists, local scientists telling us too many different things.
Yeah. I want to say, Brenda, that I have been following the SGU situation. What SGU have insisted that the employees be vaccinated to come back on their compound. And I want to officially say here that I support what they're doing. For one single reason.
I do too.
I believe that just as how we are to respect the opinions and rights of employees, individual employees, we also have to respect the rights and the positions taken by employers to safeguard their environment and to safeguard their own workers who decided to take the vaccine versus those who have not. So I think there must be a weighing of both and not just try to push it to the point that we figure if you make a decision that you don't want to take a vaccine at a particular time in your life or wherever you are, no, that is fine. I have no objection to anybody doing that, and I respect your decision. But you cannot quarrel and say that I have taken a position in my establishment. It's like me at home. And I see no difference, Byron, if I say that American Airlines is saying that, listen, you must be vaccinated to climb onto my aircraft.
That's a fact.
Yes.
Yeah, American Airlines.
And I see no difference with that versus SGU saying you have to be vaccinated to come onto my compound. Actually, I see no, and we're not complaining about that.
Chris, here's the situation, and this is, and here's what I experienced. There's a young professional woman, I think she's 23, working at SGU for the past 3 years. Through her mother. The mother is concerned because she's refused to take the vaccine and prepared to be out of work. So the mother encouraged me to have a conversation with her, which I did. And this young woman is adamant. I had a telephone conversation with her, and she's adamant. I'm not taking the vaccine. And she's refused to give me any specific explanation regarding why she's refusing to take the vaccine. Adamant.
How do you deal with someone like
serious,
that?
Yeah. And I'm saying this is a one case, but there are the hesitancy is more than hesitancy. It's just a refusal on any condition. I'm prepared to lose my job. I'm prepared because I'm the only breadwinner at home. Mother is depends on her for a livelihood, and she's prepared. Look, I'll find another job. You know, whatever.
No, she won't, because that's a conversation I had with a friend last night as well.
Yeah.
She is kind of vacillating between, you know, she has not taken it as yet, and she's vacillating. And she's saying, well, you know, Brenda, I am qualified. I'm a professional. I can get another job. I said, have you considered that it is easier to work it out with your current employer of 15 years? Because you are established in this place for 15 years, as opposed to going on the job market and becoming a new recruit. Because tell you what, new recruits have to be vaccinated.
Well,
the employer stands on solid ground with new recruits. There's no ambiguity there. You're coming into my place for the first time because of this pandemic. These are my parameters for you. So I said, think about it. She's saying, no, I never thought about it like that. I say, yeah, just think about it. Think about it. And the thing about it is just what it is about her, because she's into reading. Everything they have on vaccine and stuff, she pays attention. But there's a fear. She is just fearful, and there are people like that. She is just fearful. She did a COVID test and it didn't help because she said the nurse ram up the thing and she knows.
So it was a painful.
She's fearful. And I say to her, girl, you have to think about that. So she said she's going to give it this week and, you know, see how she feels. But I think she's closer to doing it rather than, but the person you've described, I'm running into a lot of people like that. And let me tell you, they're only saying they're prepared to lose their job, you know. It's like there's a kind of victim martyrdom because they think, and they keep saying it's my constitutional right and that sort of thing. But everybody have rights in this thing. And we having these discussions, and I keep saying, we are leaving out the part of the Constitution that addresses that a pandemic is an exception where these things can happen, right? And if SGU says, do not come to my gates if you're not vaccinated, do not come on the property, guess what? They're standing in law for trespassing, okay? But in terms of, I listened to the Bob report yesterday, Senator Andrew Lewis was on, and he was very positive, I must say, about what is happening in terms of their conversation. Said up to Friday they had discussed quite a few things, and they have put, I am reliably informed that of the 400-something staff and so on, we really have a holdout of about 30-something.
Okay, so that.
And so, but it might sound small, but you can't put them aside. You know, it has to be addressed what happens. So I'm sure in sooner rather than later, we would hear something about, you know, what is going to happen with the folks at SGU who are still kind of, because remember, a lot of people at SGU have worked at SGU for a long time. They're an equal opportunity employer, and when people go in, they seem to enjoy their relationship there and they stay on.
Well, I mean,
so you're hearing maybe the minimum amount of years somebody have is 5, 8, that kind of thing, and that's a lot in terms of employment in Grenada and this kind of service they have given to the institution. So I'm sure it is going to be worked out. But if people are being defiant, like what you just described, I don't know that you can work with them. So there are some instances, maybe a small percentage of that. It'd have to be a case of, you know, let's just end our relationship, pay you your benefits, let's move on.
Brenda, I'm quite certain that SGU would have thought about that as well. Because in these things, you have to think about the best case and worst case scenario. Worst case scenario here is that a member of staff will hold out and they are dormant and they will have to part company with SGU. And SGU, I suspect, will be prepared to pay all these people for the years of service, whatever it is, and move it along. Or some of, as I understand it now, a lot of these people who are not on no pay leave, they are not being fired or terminated on no pay leave. But remember in the brewery situation, when we had that strike and so on, by law, an employer can bring in people to replace in the positions whilst you are on no pay leave.
Well, there are lots of temporary, secretaries and drivers.
The point here is that after a while, if I don't need your service, I'll pay you off.
Otherwise. Chris, there's another dimension. at the community level, you know, and I'm going to say boldly and plainly without reservations that I respect people's wishes. You can't force them, but I could encourage you. I can give you reasons why. And in the village, Mount Morris, for example, this Thursday, we are mobilizing to have a public vaccination session downstairs, the SDA church.
Yeah.
And so we can do some mobilization, encourage
good.
persons
That's
to come out in the village to be vaccinated, you know,
Great.
because I think it's a good thing. So at the village level, I think we have to motivate, we have to encourage, because there's so much misinformation out there that's glowing now, you know, that is a distraction to a lot of people.
I also believe employers have to get more involved too.
The conversations need to be fair as well, because
Yeah.
every time you listen to the conversation vis-a-vis employer, employee,
Yeah.
I mean, even lawyers and so dancing and so on, we
Yeah.
know why though,
Yeah.
is that you get the sense that it's only the employee that have rights.
Yeah.
No. And there's an Employment Act that governs the relationship with employer and employee. So everybody, the government needs to state a position, but they have. They are saying that vaccinations would not be mandatory. All over the world, governments are saying this.
Well,
but we are finding
that have changed recently.
It's
yes, of course it has.
Russia.
Yeah.
And some
Russia
other
and
places.
Belarus, yeah.
And then a famous case in California where an employee took an employer to court for mandating the vaccine, and the case was thrown out because of the same exception
Well,
rule.
in Texas, too, the
Yeah.
119 employees who took the hospital to court, it was
Yeah.
thrown out. Over the world, what is happening is
You
that
understand?
courts are ruling in favor of public
Health, that's right.
And I'm reading and I'm looking at it, listening to things, and I do not think that the judiciary, who we should not forget is a part of the governance structure, will be willing to go against like
But, I mean-
governments and institutions and so on in a pandemic. So I am not sure that all these cases because you see the cases just getting, thrown out and
I
go
think-
back to
I
your
think here
employee, go back to your
We're going
employer.
to have,
So I don't
we're going to have a
think-
bigger issue.
I don't
Government
think
is
we're
one of
getting
the
anywhere.
largest employers. And my understanding is that the uptake in the government service is pretty low in terms of who have been vaccinated
Yeah, but how many
versus
people,
who have not.
But how many people, and that's the point I was about to
So
make.
just now government will have to say something about their own employees. What is going to happen to their own employees as
Right.
vis-a-vis vaccination?
But listen where we need to get to as well.
so-
While there are, not every service or every service you provide is a service that would be a risk in terms of vaccination. So while we have no mandatory vaccination as a policy, we have to understand that there are sectors that must be vaccinated.
Agreed. And
If you work at my hotel and you are in my spa, you must be vaccinated. If you are the chef in my kitchen, you have to be vaccinated. My guests are demanding this. Right? A spa is almost like a doctor, like a nurse, an esthetician. They're getting up close and involved with you. So that is the kind, and I'm sure that's the kind of conversations they're having at SGU as well. Some of the folks who are holding out is like, which department do they work? How would it impact? What can we do? Okay, so instead of vaccination, can they take, let's say, 2 PCR tests per week? So, and that's the thing. We have to do the work. We always want a quick fix. Employers and employees across the spectrum, across the sectors, have to be speaking to each other.
Which employee is going to spend $405 or $410 to do a PCR test every 2 weeks?
Put it out as a choice.
And of course, wait on the results, because while you're waiting on the results, what happening? What are you doing with you in that meantime? There's a lot of complexities with the labor contract, because there's a contract between the employer and the employer. And the issue is, do we have exceptions for straightening a contract because of your decision on what you have done? There are a lot of these things that are not tested yet, but based on where we see it going from all the cases, and this article that was done by the law professor from UWI Trinidad was also very instructive, and she is saying in that article generally that you can see the courts leaning in favor of public health.
Oh, yes.
With the decisions
Not
that
in a
they're
pandemic.
making.
It's
They're
public
not-
health. It's
Yes,
public health.
and it's
The
there are
courts are not gonna-
exceptions.
yeah.
There are exceptions to the Constitution, exceptions in law
Yeah.
for a lot of things, and it is not abnormal because we have exceptions in the private sector with work and how you used to work versus what it is now. Digitization is a good thing. Long ago, we used to have a lot of manual work in how we do things. Now we have computers, and that changed how we work. And this is one way this pandemic is going to change how we come into the environment and how it's going to change the environment. So I could understand some people who have medical reasons for not taking a vaccine.
Yeah.
I'm not even sure the religious reason is going to hold it to some degree. But certainly the medical one is one that if I can't take it, I can't take it. We have to see how else we can understand and do what we have to do. But this world and this situation is going to get to the point where, as again I started off saying, you're privileged if you have it, you're not if you don't have it.
Right.
And you're going to be accepted in certain quarters, and you're not going to be. New York have opened back up, fully, because they have 70% of their population. And everybody's allowed to go out and dine, go to shows. All the shows have started back. Broadway is back up and so on and so on. The movie theaters. And it is just saying to us as a population, if we were to bring our herd immunity up to 70+%, then we get back to normalcy as we know it. And New York is a good example. Why? Because they had many deaths. A lot of Grenadians died in New York.
Grenada has not
Right?
had many
And
deaths. So
the issue here
Grenada's
is,
not relating to what you're saying.
yeah,
They keep saying
and
Grenada and had no COVID, so they
And that's the point.
They're not
Well,
seeing
what
it.
about the airlift? Is British Airways still in the same position regarding our hesitancy level?
the Amber
Well,
Alert,
British Airways have their own situation where on their base right now, because with the Delta variant moving through, they're going to be on further lockdown in the UK.
The UK is now saying that even those of us who are on Amber Alert, when you're coming back into the UK, you have to test and so on. They're now looking to release that requirement.
And the amber level.
Yeah, for all nations who are at
But what
Amber.
about flights or their citizens coming to Grenada, for example?
You still have to be vaccinated.
They
to
must
come.
be
be
vaccinated,
vaccinated.
yes.
So you have to vaccinate to climb the plane.
Okay.
It look as if
Okay.
everybody else had to vaccinate except us.
Yeah. Yeah, it's one of those things that, I mean, as a people, I understand some of us have fears, as Brenda say, her friend have a fear. And
Yeah, she's
to
just
my
scared
thing
for
is, whatever that fear is, talk to a professional, talk to doctors, talk to somebody who knows, talk to people in SGO. We have a lot of specialists there.
Yeah.
We have Dr.
And
Oz.
that's
we
what
had
I
all
want
of
to
these
say about
people.
SGU as
You know?
well. SGU, as an employer, I am aware that SGU has done a remarkable job of educating their employees. SGU took a lot of time. They had Zooms, they had this, they had everything. That, I mean, I'm sure some people are still, and you mentioned religious reasons. What I am finding, because, religions like Jehovah's Witnesses and so on, who don't do blood transfusions and that kind of thing, they don't have that rule. They have basically said to their members, it's up to you.
Yeah.
They have
I know a lot of Jehovah's Witnesses that are vaccinated.
They have not
Quite
stood
a
on
number.
any religious grounds with this.
Yeah, I know.
Because a big thing about the religion is really obeying the laws of the land. They are not making blanket statements like God would cover me.
Yeah,
They are saying,
well, we had our bishop, the Catholic bishop, who did it and was leading the way for his congregations.
There's one point I want to make, Brenda, before we go to the break. I know.
Yeah.
And it's COVID related. I understood that in this business place in St. David's, that a police officer arrested a security officer for doing his job vis-a-vis insisting that face mask has to be worn. And this individual was arrested and brought to the police station. I understood that all charges have been dropped. But this is clearly an abuse, extreme abuse of police authority, if this is so.
Not understanding that we still have SOE in place and we still have regulations that talk about wearing the face mask.
Wearing the face mask, precisely.
So obviously this officer wasn't clear in his mind.
Clearly,
if that is what occurred.
Police commission was on air giving some clarity on the issue. Terrible.
Yeah, well, I hope that police officer, I suspect, will be in some trouble.
Oh Lord, that's the beauty of the human, the way we analyze and interpret things. Anyway, folks, it is Perspective on a Monday. We have a great conversation with a scientist, and he's coming to us all the way from Colombo, Sri Lanka this morning. We take a quick break and we'll be right back.
Get vax. It's your best shot. Hello.
A message from the Ministry of Health.
I accepted the COVID-19 vaccine. Initially, I felt fine, but later that evening, I had a headache. The next morning, I woke up with fever, chills, body pains, and I was just really tired. The symptoms continued, and that evening I was out by 6 p.m. The good news, the second day after my vaccine, I got up feeling great. No more side effects. I am truly happy that I took the COVID-19 vaccine.
I took my best shot for the safety of my community. Get vaxxed, it's your best shot.
A message from the Ministry of Health.
Welcome back to Perspectives. If you're just joining us this morning, we welcome you to the broadcast. It's now time to introduce our special guest panelist for today. Dr. Changa is a medical doctor specializing in infectious diseases, infectious prevention control, and tropical medicine. He has collaborated with regional and global health entities, including the World Health Organization, the WHO, the U.S. Centers for Disease Control and Prevention, the CDC, and the European Center for Disease Prevention and Control, the ECDC, among others. Dr. Changa obtained the American Board of Internal Medicine certifications in internal medicine and infectious diseases and was indoctrinated as a fellow in the Academy of Medicine, Singapore. His experience in public health, outbreak management, and disaster response. He has served as a consultant to various governments, health ministries, and national-level COVID task forces. Dr. Changa is well published in the medical literature across a variety of disciplines, including a COVID-19. Coming to us from Colombo, Sri Lanka, where it is afternoon time, we say good afternoon and good morning to Dr. Changa. Good morning, Dr. Changa. Good afternoon.
Good morning, Ms. Baptiste. It's lovely to connect with you and Mr. Christopher and Mr. Campbell. Thank you for this opportunity.
All right, wonderful. It's afternoon in Sri Lanka, yeah?
Yes, it is. It's about 5 p.m.
Right. What's the weather like in Colombo today?
We got a bit of a break from the rain. We had heavy rains back to back for a few days, but today the clouds have parted and the sun is shining through, so we're happy.
Okay, wonderful. Well, getting ready for this broadcast, I've been getting myself acquainted with who you are, listening to quite a bit of podcasts that you have been involved in, and I was really, really taken with the one where you talk about why the pandemic is an opportunity to unite and not divide us. So my question to you, Dr. Changa, power, equality, nationalism, we seem to be vacillating between those. How has this pandemic changed the world in that sphere?
I think the pandemic has unearthed some of the deficiencies and disparities that we knew we had as a people, and it has also unearthed some of those disparities that perhaps we didn't know we had. And it is like a big test. It is time for us to prove to ourselves that we can come together as humankind to meet this challenge as one. And it would be a shame if that opportunity is squandered. And I don't simply refer to health issues and loss of lives and so on. One thing is that both Grenada and Sri Lanka are very similar in a lot of ways. We are both island nations and we're both cricket crazy. And furthermore, even with regards to COVID-19, there was a time last year when we had just a few cases, a handful of cases, and our lives lost was in the single digits, 8, 9, 10, 11. And for a country of 21 million people, this was seen as a huge success. And we were being praised worldwide, for our COVID response. And that's very different from where we are today. There has been some complacency, perhaps some suboptimal decisions as far as which direction to take, and very quickly the landscape flipped, and we are pushing upwards of 2,000 deaths as we speak. So it went from single digits to thousands very quickly, and we heard the sentiments back then. Oh, we are a blessed nation. We are strong. But it's a lesson that we learned the hard way. And so as when I look at Grenada is very, very fortunate to be where she is right now with regards to COVID-19. And I hope and pray that it stays that way and not go the other direction as some of our countries did.
Right. Do you as you look out globally from your own home country, what is happening there, and as you do research work linking, you're looking at humanity and world situations, do you think this pandemic would make us, less prosperous, less free? What's your response to that?
Well, it's freedom is a funny thing, isn't it? Ask 3 people, you get 3 different answers, and to me, as a father of 4 children, freedom would be the ability to take care of my children to the best of my ability and to go from there. So in an emergency situation, there are certainly constraints and curtailing of certain rights and freedoms that we are so accustomed to and perhaps even taken for granted. And that is expected. One cannot expect a pandemic to rage through the planet and expect the same degree of freedoms when those freedoms may negatively impact our friends, our neighbors, our communities, and our country. Each person's idea of freedom is different, and we accept and acknowledge that. But we also accept and acknowledge that these are extreme times, and perhaps fortunate people in Grenada may not have the same perspective as perhaps India or Brazil, which is closer to home for you,
Right.
or Sri Lanka now does.
Thank you.
Doc, good morning, and happy to have you on the program. And I want to take you up on a related issue in regards to hesitancy and Grenada's situation regarding hesitancy, because our hesitancy is pretty high if you understand how much of us are vaccinated, which is just under 20,000. And there is this debate about, the WHO approving emergency use of vaccine versus what is normal use. And I use the word normal in inverted commas because you hear people saying, the FDA in the US didn't approve this vaccine, and it's just WHO that's saying that it's approved for emergency use because the trial numbers are different and so on. What is your view, and could you explain to our listeners and viewers the difference between the amount of people you put on trial to declare use of a vaccine for emergency use versus what will be the normal trial time and period of people that would be required for the use of a vaccine?
Absolutely, and that's a great question, and it's a fair question for anyone to ask. Vaccine development is a long process because of the stringent safety measures that the manufacturers and the regulators have to adhere to. On average, a vaccine from start to finish may take 7 years to conduct all safety and efficacy and to get to the market, and it may take as long as 20 years. It just depends on the vaccine. So the concern when a vaccine is manufactured in a little more than a year is valid, to see if the manufacturers and the regulators have done their due diligence. And back to our operating platform, that this is a pandemic and it is an emergency. We don't have the luxury of time to do a 7-year trial in order to give it the full emergency use authorization. It's just that it is authorized to be used in emergency, which globally we are very much in a crisis or an emergency. Having said that, the techniques or the technologies that go into making a vaccine, for example, the AstraZeneca, which is pertinent to Grenada from what I understand, the idea of having a virus carry an antigen or a protein is nothing new. That technology has been used for decades, for several decades. What's different is that the actual protein being used is a COVID-19 spike protein. But this method of vaccine manufacturing is, as far as the AstraZeneca and the viral vector vaccines are concerned, go back to the times of the fever vaccine, which is many years ago. So, of course, the mRNA vaccine have a newer technology, but even though it's been used for the first time, we have been familiar. However, getting back to what's relevant to Grenada, it's a viral vector vaccine. and the viral vectors have been used in vaccines for a long, long time.
And the question, Doc, follow up to that is that you hear people saying that, I'm going to wait to take the vaccine because it's just a few thousand, in the trials, I think phase 3 is upwards of 30,000 people that have to be tried and tested with the vaccine. And you hear people saying, oh, they didn't figure the numbers high enough yet and the risks are still high enough. But when you counter by saying, listen, we have millions of people that have taken the AstraZeneca with very few deaths related, if at all, and reaction. What is your view on this? Because some people are saying, I still want to wait. I want to wait until I find the numbers are higher in terms of who have taken it and the reactions. Do you think that when you hear this about waiting versus having vaccines available to protect yourself, do you think that's a plausible argument to put forward?
Well, there are a few things that we must consider. Let's take first the time it takes to enjoy the full benefit of the vaccine. You have to get a first dose, and in the case of AstraZeneca, you have to have a second dose, and that may be anywhere from 6 weeks to 15 weeks later, depending on each country's regulatory decisions. So let's say 12 weeks, 3 months. You get your second dose in 3 months, and then you wait 2 more weeks for all of your immune reactions to kick in to be protected to the best extent possible by that vaccine. So you're looking at 3.5 months start to finish. Now, if anyone would take out their calculators and start with, let's say, 2 cases of COVID-19 in the community, and let's say the time between infections is 5 days, and let's say one person can give COVID-19 to 3 other people. So you start with 2 people, and each of those 2 people will give it to 3 other people 5 days. And then you keep doing this every 5 days. Each of those people will give it to 3 other people. And you just use your calculator and go to the power of 3 and use a cycle time of 5 days. And you will see that very quickly, you will get to 10 cases. Perhaps, shorter than 3.5 months. So it's simple arithmetic. You can even start with 1 case, and that 1 person will give it to 3 people in 5 days, and then those 3 people will give it to 3 other people each in 5 days, and you just keep multiplying and multiplying. So for a country, so that is the danger of the approach. Now, on the flip side, I must remind everyone that what the vaccine is best at is not actually preventing transmission. We are still waiting on the data, and this is very important for people to understand. What the vaccine is really good at is preventing death and preventing hospitalizations. It's not superb at preventing people from getting COVID in the first place. You could get COVID after the vaccine, but you will have some mild symptoms. And it's not really, really good at preventing transmission of COVID from one person to another person, but it is excellent at preventing death and hospitalizations. Now, why is that important? Imagine the number of hospital beds you have in Grenada right now, counting St. George and all of the hospital beds. If the population of 100,000 gets COVID-19, and let's work with the number of 10%, and that's a very conservative number, 10% having severe disease. So all of a sudden, within a span of 2 weeks, you could have 10,000 people needing hospitalization.
Right.
Okay? 10,000 people going to the hospitals in Grenada seeking medical care. So the real danger of COVID-19, in my opinion, yes, there's an individual risk. If I get COVID-19, I may have a 1 in 100 chance of dying. But there is another threat that is not recognized often enough, and that's what it does to our health systems. If enough people get sick enough that they need to go to hospitals, the hospitals become full. We won't be able to treat COVID-related complications well enough. But what about all of the other medical conditions like heart attacks, strokes, blood poisoning, kidney disease? We will not be able to treat those either. So there will be a lot of collateral damage if a nation gets affected with COVID very quickly, so quickly that a significant proportion of the population will need hospital care. And that's what you see. That's what you see in many countries. Even in Sri Lanka, we are scrambling to build new hospitals. And that's not something you want to be doing in a hurry. So that's something that I really want to highlight.
Yeah, wonderful.
Dr. Changa, good morning and good afternoon at the same time. I note that as a scientist, your specialization is in infectious disease prevention and control, which is critical. But yet we have a pandemic, we have a world crisis, we have millions of deaths in an ongoing situation. Has the community responsible for infectious disease prevention and control, I mean, has it failed the world, given what we have? But even so, where we are, and looking at it globally, because Grenada, we're part of a region, we're part of a network, we're part of the world. What's going to happen going forward? When would this pandemic come to an end? What's the future like? Give us some insight into this.
And that's an excellent question. And let me draw a parallel between SARS-1 that happened in 2003 in Singapore, Hong Kong, and so on, and SARS-2, which is COVID-19. SARS-1 had this, our ability to spread the virus from one person to another person happened about 3 to 4 days after we got symptoms. So even a child will tell you, well, what if we just find people with symptoms and isolate them from others? Then 3 days later, when they start spreading the virus, there's no one to spread it to because you've isolated. And that's exactly what happened. And that's why in 7 months, SARS-1 just fell off the face of this earth and it was gone. What happens in COVID-19 is we spread the virus to others perhaps 2 or 3 days before we even get symptoms ourselves. So there's no way to identify who will spread the virus and who has the virus. So that's a huge, and you very rightly brought up the point of infection prevention. So we cannot go by symptoms to institute preventive measures, because I may have COVID-19 right now. I may get symptomatic in 3 days from now, but I may give it to others, and which is why even to do this meeting, I stepped away from my clinic and I came to a secluded place where I could take my mask off and participate in this conference. So that is a huge challenge in terms of prevention, and whether we have failed, I believe so. And I think all of us are collectively responsible for all of the big and small failures that have resulted in this many deaths. And again, coming back to the original question, from the perspective of who are we as a species, what this has shown us is that we are not very good at communicating. We are not very good at giving a single, uniform, common sense message. Correct. We are not very good at being socially responsible.
Correct.
So this has highlighted a lot of issues that perhaps we
yes. One other dimension of the virus and the pandemic is what we hear about new variants, it's literally new viruses. That what is the danger there in terms of this particular development, whether it's mutation and the vaccine's ability to prevent the spread of the disease? What's the danger there?
It's that's an excellent question. Now, if I can just give a 20-second lesson in mutations. A mutation is a genetic mistake that the virus makes when it tries to replicate and make other viruses. So you're trying to make a photocopy, but you make a small mistake. And that happens all the time when viruses try to replicate. Now, if some of those mistakes are carried on to the new virus being made, that's called a variant. So a variant is a virus with one or more mutations. Okay. And variants happen all the time. And even in COVID-19, there are hundreds of variants. But only a handful have been designated as variants of concern, VOC. And these are variants of concern because the mutations they carry give them an advantage. Either they spread faster and more easily, or they avoid the body's immune response better than the original version, or their response or the ability of the vaccines to curtail the new variants are less. This is why variants become variants of concern. And I want to highlight, related to this, a very poorly misunderstood word called herd immunity. I don't know if there's a more hotly debated word in infectious public health as herd immunity. That is not the scope of this discussion. But what I want to point out is herd immunity will potentially be of use if it's the same virus spreading throughout the population. The moment the virus or the variant changes and can reinfect the same population, which we saw with the South African variant, reinfecting people who had the UK variant and recovered, they were easily reinfected with the South African variant because the variant was different enough to escape the body's immune response. So the moment we enter the subject of variants that are so different from the original virus that came from Wuhan, the conversation about herd immunity becomes non-applicable. Because if this virus is allowed to replicate, if this is allowed to replicate uncontrolled, more mutations will happen. And if those mutations stick, more natural process. So that is why testing, tracing, and isolation, TTI, you test, you trace, and isolate. That should be the mantra of any entity that wants to have any kind of meaningful control in this pandemic.
That's very interesting, Dr. Changa, that point you just raised about, because as we see the changing ecosystems of these variants within the COVID-19 scenario, the vaccine which we have, which says it stands between us and the virus. So what do you see? What do you see as the new challenges, if you will, going forward for this? And doesn't it, and just to follow up to this as well, doesn't this raise additional challenges for those who have the hesitancy with the vaccine?
Yes, I hope you don't mind to turn the video off because signal was a bit weak on this side. So the variants will certainly bring about challenges that we are yet to see. And fortunately, even with the Delta variant, which is the one we worry about most, which spreads perhaps 50% more efficiently than the previous variants, the vaccine, including the AstraZeneca vaccine, is still very good at preventing deaths and hospitalizations. So thankfully, that property has been retained against the Delta variant, even with our known vaccines.
Okay.
Of course, the effectiveness at preventing disease in the first place is certainly not as good. The effectiveness at preventing transmission, which is still being studied, I assume, will not be as robust. But thankfully, after two effective doses, it still retains the mid-90s, mid to high 90s effectiveness of preventing death and hospitalization. But we don't know what will happen with future variants of concern. Maybe we may not be as lucky with future mutations and variants. So that is probably the biggest challenge, and that's why countries like New Zealand went for elimination. And I think that should be the goal of every country.
All right. Just before we let you go, Dr. Changa, what would you say? Because I think one of the biggest objections really of the vaccine is folks are saying, listen, I want to look and see what's going to happen. I want to wait a little longer. You addressed you addressed earlier the conversation about the emergency use versus experimental use, and we're not doing experimental, we're doing emergency because you established it was being developed because since SARS-1. What do you say to folks who are just holding out and waiting longer for a vaccine?
So what I would wait is very quickly, I'll tell you, we should ask ourselves 4 questions in any major decision that we take. One is, what's the benefit of doing it in case getting the vaccine? What's the benefit of not getting the vaccine? And what's the risk of getting the vaccine? And what's the risk of not getting the vaccine? So when you go through these 4 questions, the risk of blood clots with the AstraZeneca vaccine is perhaps at a 1 in 100,000, and that's a generous estimate. The risk of death from COVID is 1 in 100. So even if you go by the numbers, the answer is very clear that preventing death from COVID using the vaccine is many folds better numerically than blood clots, including side effects, including blood clots. And as we touched on before, waiting means waiting 3.5 months. That is simply not a luxury that COVID-19 affords. Right. 3.5 months is a very long time.
Right. Well, thank you so very much. And just before we let you off the hook, just a word to our countrymen here in Grenada, because there's this rationale that because Grenada has done so well in terms of infections, that we really do not need to be as urgent about vaccines. Can you just talk to our countrymen about that?
Yes, and my only recommendation is learn from the mistakes of others. There have been many countries, many people that think or thought as you do now, including Sri Lanka. People thought it was the weather, people thought it was the food, people thought that we were somehow genetically more equipped to face the virus. People thought because we were an island nation that we would be fine. People thought that we were wrong. And when it's severe COVID, where you can't breathe, no matter what doctors do, or when you lose a family member or a loved one to COVID-19, that's not the time. I personally don't even like to take paracetamol, ever. And even though I'm an infectious disease doctor, to get me to prescribe an antibiotic is like an act of parliament. My colleagues laugh at me. But so I'm very, very, very careful about prescribing medicines and putting things into my body that are not natural or from this earth. But I myself took 2 doses of the COVID vaccine. And it is because I asked myself those 4 questions: the risks and benefits of getting the vaccine, and the risks and benefits of not getting the vaccine. And the numbers were so plain to see.
All right. Thank you so very much, Dr. Changa. Really, really appreciate it. Thanks to all you do, scientists like you, and thank you for taking the time to so calmly, rationally, and scientifically talking to us this morning and answering our questions with such elegance. Continue to stay safe there in Colombo, Sri Lanka, and do have a good evening and enjoy your dinner.
Thank you, Ms. Baptiste and Mr. Christopher, Mr. Campbell. I really appreciate the opportunity.
We certainly appreciate
Thank you,
it
Doc.
as well.
Thank you.
Thank you so much. That was Dr. Changa, and we'd like to really thank Kerry Clement for giving us access to him. Thank you so very much for that. Guys?
Don't.
Well, go ahead, Byron. You go ahead.
Yeah, what resonates with me is the message to the country. Think about what has happened elsewhere. Don't make the mistake that others have made. And it all has to do with vaccination. You know, we have an opportunity here. There are countries that don't have that, where the population wants the vaccines and they simply don't have it. We have an opportunity here where vaccine is available, free. And that resonates with me. And also the question of, yes, there's risk, like everything else, but the risk from not taking it far outweigh the risk of taking it.
Yeah,
So that rests with me. So again, I just want to appeal to everyone to give deep consideration to the vaccine. Makes sense to me.
Yeah, and my closing remarks would be certainly along those lines, and the fact that, you know, he said 3.5 months. The amount of cases you can have in 3.5 months, if you know what they call maths.
Yeah, as it relates to waiting.
Waiting
Yeah.
versus, you know, having a vaccine and giving yourself some level of protection in that 3.5 months.
Yeah.
You know, so you are at far a greater risk of not having any sort of vaccine at all and waiting than having something that gives you some level of protection. So I thought, you know, at the end of the day, he was clear that the advantages as a person and as a nation rest with us getting more vaccinated.
That's what scientists do, and well, economists do, and engineers, risk-benefit analysis.
Yes.
And it works every time. Just to give some kind of semblance as to where we are, we have done number of persons vaccinated first dose as of Friday, 19,217.
Still under 20,000.
Number of persons on at second dose is only 10,608. Vaccinated is low. I think the WHO is looking at, when they talk about vaccination percentages, the indices is for the fully vaccinated, and so Grenada is still around moving around 10%. I saw us became very started to compare Barbados to us over the weekend, and Prime Minister Motley made the announcement that as of June 30th, all will be lifted. Well, you see, we keep comparing, but we're doing a lot of false equivalencies, because what are the factors impacting Barbados is freeing up. They are at 40% vaccination. Trinidad just started 2 weeks ago. Over 250,000 people have been vaccinated already. It's a drop in the bucket, yes, because Trinidad is 1.4 million people, but they are going out in their droves to get the vaccination. Trinidad's problem is going to be they may not have enough vaccines to give to their citizens. You know, so these are the things we have to start, kind of thinking about. Just to let folks know, I know a lot of people are due for their second dose. So today, from 9 to 2, you can come to the Kirani James Athletic Stadium. That is today, tomorrow, Wednesday, Thursday, Friday, all this week. The Ministry of Health will be out, of course, at the Kirani James Athletic Stadium and all health centers across the island, as many folks become eligible for their second dose. And if you've made the decision, like my friend is going to make soon, right? To go out and get vaccinated. Conversations. See both sides of the coin. You know, if I've given 20 years service to you and I'm hesitant, the relationship we have established, it accounts for something. So let's talk about how we get over the hump, or decide that we part ways.
Well, it's the options.
Yeah, that's it. Thanks, gentlemen. Have a great week.
Thank you, Brenda. You too. And to the rest of the crew.
Thank you.
And thanks everyone. Thank you to everyone who joined us this morning. Dr. Changa, who came to us from Colombo in Sri Lanka. Thank you so very much.
Small
Valuable
world.
conversation with you. Really appreciate it. And thanks to all the gentlemen here. Richie Oliver, our executive producer, Kishan Thomas, our producer, Nazim Benjamin, who provides our professional streaming services, Blondell George, who directs things around here, and Kirk Oliver, who keeps us all clear and crisp. Thank you, everyone. Trust everyone has had a great Father's Day and you're ready and raring to face the week again. Until next Monday, when we have another Perspectives, I'm Brenda Baptiste. Bye-bye.
Bye.